Hi, everybody. Welcome to one of the section for Keep Moving. Again, Keep Moving is a new group that we decided to form as a result of the proposal that we submitted to Florida Atlantic University. In this group, we are charged and encouraged to help people to physically distance themselves during this COVID-19 period. And we have various programs for you. On this program, it's about question and answer on how we can have more knowledge on COVID-19. And we have a special guest today. Our guest today is Ana Paula Harwood. She's an advanced practice registered nurse. She's been in oncology for the last 14 years, treating oncological patients with standard care and therapies and clinical trials at Sylvester Cancer Center. She's originally from Brazil, where she started her career as a registered nurse. She moved into US, where she obtained her MSN and Doctor of Nurse Practice. Her DNP capstone was focused in chemotherapy side effects and symptoms and all the management guidelines. She's married and has a dog that is named Dia. Please welcome to our session, Ana Paula Harwood.
Thank you, Tolu. It's a pleasure to be here.
Thank you so much. I'm just going to ask you a couple of questions. Whichever one you can answer, good. If you cannot answer it, we can move to the next question.
Sure.
And because of your specialization and the knowledge that you have, my first question will be, what is COVID-19? In case somebody is hearing that for the first time, how would you educate that person on COVID-19?
Sure. So as far as I know, COVID-19 is one of the coronavirus named COVID-19, which we have history of coronavirus in many other kinds of infections in the past. This one is another coronavirus 19, happened to escape from a wet market in China. And the difference of this COVID-19 is that it spreads very fast. And it's initially attacking people's lungs, as far as you know. But so far, it's mainly mainly respiratory symptoms, but we are seeing cases of kids being infected now with some sort of cardiovascular inflammatory disease, which seems to be very serious as well.
All right, thank you so much. I'll move to the next question. So currently, people are trying to compare the situation with hurricane season, and some people think this is better than the hurricane season because there's electricity for people to watch Netflix and things like that. What do you think as a nurse practitioner?
In terms of
comparison of the difference between the situation, is this better compared to the hurricane season and things like that?
Well, I think this is completely different from hurricane season. However, we have to prepare ourselves as we prepare when we during the hurricane season for any other storms that tend to be very not only unexpected, but cause a lot of damage. Mm-hmm. So we are aware of hurricanes and we do the preparedness. This virus manifestation is something that we always heard of, but we never really knew how it could start and how it would manifest. So this is something completely unprecedented. And I think we still need to know more about it. I don't think we have, from what I've been listening and reading, we don't know everything about this virus. So this is something completely different.
All right, thank you. I'll move to the next question. What is the chance that a nurse that is treating a COVID-19 patient will be infected based on the statistics that we have now?
Right. So we as a nurse practitioner myself, I don't work in hospitals, but I work in an outpatient clinic where I see patients. I'm not seeing patients face to face. I'm using technology, telehealth. It's in the through telehealth. But we have a hospital, and the nurses in the hospital now, they are mainly working with patients with COVID-19. The patients who are going to the hospital now, they only really go on an emergency basis because of the high infectious rate of this virus. And of course, they need to have all kinds of PPE protection, the mask, the goggles, the gown, the face covered. And oftentimes we don't see that. At the beginning, this was a major problem, and I think there was a lot of concerns about um, uh, the front fighters being infected because there were some, especially in some place, some lack of PPE, of these materials so needed to not only to protect themselves, but to stop this from transmitting to others, right? So I think the healthcare professionals, especially nurses, are at the high risk of getting infected. That's why those PPE and safety measures are so important.
Thank you. I'll move to the next question. Many people say that the current COVID-19 is a political mistake. A political mistake. And other people are saying maybe God is just telling us something, the world is coming to an end, and things like that. What do you think?
Right. I don't know exactly what they mean by politically mistake. I think this is real. It's serious. We have many other kinds of infectious disease like the Ebola, the HIV in the past, where we didn't know what it meant. We didn't know how to treat, and it took ages to find a vaccine and a cure. So today we have that pretty much under control. And we have other epidemics in the past where it killed many, and we finally found the cure, and we were able to control it. I think this is something completely new. We have to be very careful the way we are in contact with animals, right? We treat animals, and we are basically eating meat more than ever. So, so we are creating ways of creating new kind of infections or epidemics that we're not even aware that we are causing that. But I believe this is real. There are some talks about this virus escaping a lab. I don't know about that. What I've read so far is that this was something that was transmitted from an animal to a human, and now it's transmitted from human to human with a velocity unprecedented.
Do you think we should stay away from animals in total, or what? How do we make sure we space ourselves from animals now? Because, for example, in America, people love animals so much. Sometimes I even feel that they love animals more than they love humans. So in this kind of environment, how do you convince somebody to be careful about when they are touching animals and things like that?
Right. I think we have to be cautious, right? We humans, we take vaccines to avoid disease, and we vaccinate pets to avoid disease. And that's how one way of taking care of these pets. What I'm talking about are the ways that we sell meat. We kill animals in order to eat them. So we have to be very mindful that safety in these places, sometimes they are not checked, and we don't know what kind of sanitation it's being used. And because of that, we need to be more careful. And that's basically what I mean. I work in oncology, so I highly recommend my patients to have more plant-based type of food than animal food because it's healthier. So, and the majority of people who have health issues, they, by trying to have a healthier lifestyle, they tend to choose more plant-based of food than animal food.
All right. Since you mentioned oncology already, and I'm also doing some research on prostate cancer and things like that,
Right.
I want to ask you this question. Do you think that somebody who has prostate cancer, for example, another person is more susceptible to the COVID-19 situation than healthy person or things like that?
Right. So I've been asked this question from a lot of patients. We have patients who have been diagnosed with cancer, are on surveillance, right? And there is no evidence of disease, and they have a good, they're not immune suppressed. So they have a good lab work, white count. So I'm not worried about these patients. I am worried about patients who are in current treatment, who have evidence of disease and are immunocompromised. So those are the patients that we have to be very careful about.
All right. So the most important thing is the white blood count, because that's what we use to fight the infection that enters the body. So if the white blood count is okay, then the patient should be okay regardless of if they are taking any treatment, right? That's what you said.
Not necessarily. You know, today we use a lot of growth factors to increase the immunity when they are on chemotherapy, because we know that chemotherapy do depress the immune system and the disease as well. So for patients who have disease and are on current treatment, I highly recommend them to stay home. To if let them go out for, let the family members to do the shopping, to do whatever they need to do for them. Of course, they have, when they are on IV treatments and they have to come to the center, we try to use social distancing, masks, hand hygiene, and we are very cautious about taking care of these patients.
All right, thank you. I'll move to the next question. So my next question is, do you think after all this time, can we ever return to the previous situation whereby everybody can walk very closely, there's no 6 feet apart and things like that?
Right.
Is there any chance we can return to that situation?
Well, right now, there are many states who are trying to return to that norm, right? To that. So right now, what we are doing and what I've been hearing in the news is the governments want to restart opening places at the lower pace, at the less capacity, hoping that the population use the social distancing, the use of mask, the hand washing, all the safety that is necessary. My concern is that, and I believe that's not only mine, is that a lot of people will not obey that, or maybe understand the severity of that, and it just lacks on those guidelines, on those regulations. But I think eventually that's what we are going to do, little by little, reintroduce, back to society. Because even though the government is helping the small business people who are not really in bad shape, they will not receive help for continue to receive this kind of help. So they need to go back to work, but mindful that they do need to be safe and use the guidelines that are recommended.
Thank you. The next question is this. You mentioned that you're working from home, right? You use telecom?
Actually, right? I go to the office, but I see my patients like we are talking now through telehealth.
Oh, so they don't come in contact with you. It's like a screen. Okay, I understand.
Right. So so we have a portal where they can see their labs, their appointments, everything, right? So they access those portals in IT, and we have telehealth for quite a while, but we really, I think we didn't have a really understanding of how much this can be helpful. So for patients who are older, for patients who cannot come to the center, for patients who are who have a lot of comorbidities besides the cancer. So those are the patients that most likely will continue telehealth, despite the fact that we are reintroducing, face-to-face appointments to the clinic. But this is a tool that is we are using, and it's really very helpful.
Wow, that's nice. Do you think some other organization can use this so that people can work from home and still earn some money? Because now the unemployment is really high and things like that.
Right.
Is it
So
is
in our
is
right. So
go ahead.
in our institution, for example, most of our clerks, they are working from home, right? So they are not even coming to the office. So we have online classes, online conferences, and actually, it's very helpful. So it's something that eventually, maybe if we can use together with, reintroducing back to normalcy. But the normalcy, we have to create this new normalcy, which will be safer and still being able to do what we have to do.
Oh, that's good. Thank you. The next
Mhm.
question is on traveling. How would this travel? Because some of us still like to travel, go to
Right.
other places. How can this situation affect people traveling to other states and other country after all this is
Right.
over?
Right. So the traveling now is extremely low, mainly in cases of emergency. But I was listening to a scientist talking about the negative pressure, and I heard his comments that in these airplanes, the atmosphere, the air is safer than the ones that we are having in our own homes, because they use negative pressure like they use in a patient who is in isolation in a hospital, where the air works differently with the pressure. So I think that's something that we have to be mindful of, right? And again, reintroduce it slowly with the same care that we are using in any place that we go to, the 6 feet distancing, the mask, the hand hygiene. Make sure if you have symptoms, you stay home, you don't travel, right? And that's what we are doing. For example, even for patients who go to treatment to our centers, we have tents outside the unit, the clinics, and we check these patients to see if they have any symptoms, any fever, any respiratory, any whole nose running. Because if they do, they are sent home, and they are in quarantine. And if the symptoms continue, we are testing them. Obviously, we don't have tests for everybody, but these patients who have symptoms, and the symptoms still don't go away, those are the patients that we are testing.
Thank you. My
Mhm.
next question is on economics, how this is affecting people's businesses and things like that. Many people think that the gap between the rich and the poor is going to become wider based on
Right.
COVID-19, despite the fact that there's stimulus check from President Trump and things like that. What do you think people can do to actually make sure that they can be on their feet after all this is over?
Yeah, I think this is a worldly worry, right? Because the economy is crashing everywhere, and of course, the poor, the one who has access to things, are the ones who are mostly affected, because they don't have the basic stuff. And of course, with something of this, that's why we are seeing probably the highest numbers of this virus in places where people are together, and we have to be mindful of that. So the economics, I'm sure this is going to affect, and it's being affect the whole world, and that's why there is concern about going back, because I'm working from home. I'm having my check paid, but people who are salary, who need to be out there work, they are not making any money. So those are the ones that we have to worry about. And with that in mind, we have to think about restart, but restart things slowly with safety that we are doing the right thing, and this is not going to get worse instead of getting better. I heard this term before. People want to be safe, but they don't want to give away their freedom. Well, sometimes to be safe, you have to be locked down.
It's also very difficult because we say America is the home of the free, right?
Right.
The freedom is here, and that's why you cannot really tell somebody to wear their mask if they don't want to, things like that.
Right.
The next question is this: should COVID-19 patients quarantine themselves in a house that is very far away from the whole world, or they can just stay at home? Which one? What do they have to do?
Right. So I think they have to be more isolated, right? That's what quarantine means. If you have any symptoms and you need to, and you with a very transmissible disease, you have to be isolated. And this isolation is in terms of probably from your own family too. If you have a room in the back room where you can stay, where you can be separate from your family, I think that's what isolation means. And if you mingle with your family, you have to be mindful that you have to be washing your hands, you have to be using masks, you have to be using distancing, right? All those things they have to be taken into consideration. And if those symptoms don't go away, even though you are in quarantine, this is a person who should be tested.
All right, so I have unfortunate news for you. I went out today. I can still see some people gathering together, talking without wearing masks, and they are very close together. And it shows that some people still believe that this is not really true. It's not serious. How do you convince people like that this is serious?
Look, if they don't listen to the news, if they don't read the newspaper, it's hard to get them to understand that, right? This country has 1.5 million cases of the COVID virus. It has almost 100 deaths, only this country. New York had a huge number of deaths in a very short period of time too. And they were very serious about confining people, getting their hospitals, improvising hospitals, and in taking this very serious. And apparently this is a big state where they were able to get this to flat the curve, or at least make the curve to come down. So I don't know what else we can prove, right, that this is real. And I wish I could show them a CAT scan with the lung picture of a patient with COVID-19, because it's terrible. It's terrible for these patients who are on ventilators. There is no lung tissue seen. It's all fibrotic. It looks so terrible. And this is just a matter of time for patients who have that condition.
All right, so that leads me to my question. The first question is this: some patients recover.
Right.
Some patients are recovering, others are not recovering. What is the difference? Why is some people recovering and some other people not recovering?
Yeah, that's a million question, right?
Yeah.
It's this, it's hard to say why some make it and others don't. And I think we have to look into, because now we are seeing young people, health people with no comorbidities dying, right? We are seeing children who are healthy. Why are they getting what they are getting with this inflammation of the vessels? So, and they are dying too. So it's very, I don't have an answer for that. It's we have, like in oncology, and you know this, you can get two patients with the same disease, same treatment, and the outcomes are completely different. Then the million questions you ask, does this patient who made it, does he have a stronger immune system and a less aggressive disease compared to the other one? So this we don't know. So it's related to how strong your immune system is, how much you could fight that, right?
The next question, thank you very much. The next question that is connected to that is the numbers. At some point, we have about 3 million in the whole world, and almost half of it is coming from America. How is that? Is that really true? Should we trust the numbers? Is it more? Is it less? Things like that. Do you have anything to say?
I think the numbers are a good indicator of showing where we are. Obviously, even in American tests were not done the way it should be done, right? With a population of 300 million people, how come so far we have 1 million tests? So it's unbelievable, this. And one of the ways to know, besides social distancing, besides safety, is testing. We are not testing. In order to take control of this, we are being locked down. We are doing social distancing. We are doing the PPEs and the masks and everything. So until we have a solution for this, either with vaccines or with the treatment, so far what we have in terms of prophylaxis, in terms of treatment, didn't work. And we don't know if it's going to work because we don't have enough randomized trials proving that. So it's really very hard to say because we don't have enough testings. So what we are doing now is probably what we should continue doing, being safe, trying to use the social distancing, try to use mask, hand sanitizer and things like that.
Another question that is very close to that is where there's money to send out to people, right? Because they're staying home and things like that.
Right.
The development of a test, is it because it's too expensive or it's just impossible to?
Right.
Do you know why it's difficult?
So it's interesting because some academias were required to produce, laboratories were required to produce this testing, and we still don't have enough. To be honest with you, I don't know where the holdup is, where the problem is, but it's interesting in a place like this country not to have enough places available to produce those testings.
Thank you. Next question is, if somebody find out that they have the virus, what's the first thing they're supposed to do? If they
by either the swab or the serology you're talking about.
Mm-hmm,
so
yes.
The first thing to do is, if they are asymptomatic, they should stay in quarantine, period. Right? Distancing from everybody, even their family members. If they are symptomatic, obviously they have to go to the hospital. Right? And at the hospital now, they are in the emergency room. They test people before, because they want to know where they're going to send them. If it's to a place where they have the COVID positive, the COVID or the suspicious patients. So this patient, if he's asymptomatic, he needs to be in quarantine. He needs to isolate himself. And of course, he can, if he has any symptoms, but their symptoms are let's say, if they have the symptoms, they should contact their PCP, okay, and get some guidance.
That leads me to the next question. I don't understand why somebody will be so sick and still not show any symptoms. Because I think that's the biggest problem that we have. Because a lot of people are walking on the street now, they think they're okay, and if somebody is actually sick in their body, they're not feeling sick, but they're going to come in contact with somebody that is elderly or very sick already, and they're going to transmit it to the person. The person's going to feel more ill, while they are just living the normal life. I don't
Right.
understand that.
Absolutely. No, I agree with you. If I start, the other day I was having runny nose and I said, oh my God, should I test myself? Right? But again, if I didn't have fever, I didn't have shortness of breath, I didn't have coughing, and no GI symptoms on the list that we see posted, so I couldn't be tested. I'm not, older than 65, so I could not be tested. So, but you're right, because a lot of people out there are asymptomatic and they may carry the virus. That's why it's so important to keep the social distance so you won't contaminate someone that's probably doesn't have the same immune system that I do and will become very ill. That's why testing it is so important. If we, on the lack of that, because we don't have that, we still need to use social distancing. Now, if you have any concerns that you have the virus or somebody else who knows you, or you should either contact your PCP. If you cannot get a hold of someone that cares, knows you, you should go to the hospital.
Mm-hmm. All right, thank you so much. Next question is temperature. How does temperature affect this virus? Is there any
Yeah.
research on this or anything that
So
is known?
somebody may have the virus and have no temperature, have a regular temperature, they found. So not everybody who have the COVID-19 present with high temperature, with fever, right? So you now, if you present with fever and you start having other symptoms, then most likely you do have the virus and you do need to be tested. If you cannot find a way to be tested, you need to go to the hospital. Either, or they say call the primary physician because it's probably more effective. But if you cannot find your primary physician, or if you don't have one and you have fever and there are concerns of the COVID-19, you have to go to the hospital.
That leads to my next question. You said go to the hospital. Even at the hospital, they are very scared too. When you get to the hospital, they
Right,
ask you, did you travel on a cruise? Did you come in contact?
right,
It's like
right,
everybody.
right. So the point is, if you have symptoms, right, and you are not dying, you are not dying, quarantine still is the solution. You
Mm-hmm,
have to do quarantine, because if you go to the hospital, they're going to quarantine, they're going to isolate you.
mm-hmm,
And if there is nothing proven to infection to treat, they are going to isolate you and they're still going to run a bunch of tests. So if you feel safe to be home and take care of yourself, like continue to hydrate, eating well, and taking care of what you need to take care, if you improve, isolate yourself. We always recommend patients to get a hold of their primary physician, but it's true, a lot of people don't have a primary physician. So, and if you see that you have symptoms, but you're not getting better, yes, it's true. Nobody wants to go to the hospital. I have patients dying at home and they don't not want to go to the hospital because they know, because they are ill, if they go to the hospital, they will die. And I cannot tell them they will not,
mm-hmm,
because we know how hospitals are now, right? They probably have more cases of COVID-19 than anything else.
mm-hmm.
But we still have to use the guidelines. We still have to pay attention to the government guidelines, to the CDC guidelines. If you have symptoms and you are okay, contact your PCP. If you don't get better or you get worse, then you do need to go to the hospital.
Wow. My next question is still on temperature, but now on the external environment, the
Right.
the table, the shelf, the books. How long can the virus stay on such environments, in the food, in the water, and things like that? Do you know?
Exactly. So that's why the mask is so important. The mask doesn't isolate those particles 100%, right? That and again, the use of mask is to protect you from me, right?
Mm-hmm,
Because it's proven that the particles of this virus can live in material things. it can, the distance, the 6 feet distancing is to prevent this. To be honest with you, I don't know how long they can live if you have the virus and they fall into in objects. But again, I'm talking to you and now you're using masks. So if I have it, I'm contaminating everything.
Good. So now that you mentioned that, the question that I want that is very close to that is people use masks everywhere, and unfortunately I can see people driving their car, they're alone in their car, and also they're still using their mask. Is it the virus
Right.
is affecting other parts of the body, the brain cells and things like that, or why do they have to cover their face while they're the only person in the car? Is there a need for that?
Right. I think it's more like, it's telling I'm telling myself that I'm taking care of this, and as a human being, right? And I'm sure I'm doing something that is expected to do because it's a guideline. It's supposed to be the right thing. So I may not, probably I don't need to drive with a mask, but again, for the same reasons, when you go to a social place, when you are doing any gathering, you want to be careful, you want to be safe. So it's just a reminder that you are following, that's how you are following the instructions and you are doing the best you can.
Right. How about with kids? Is it really common? What?
Well, now that we know that also kids are getting infected, so they need to be careful too. They need to have the same precautions that we adults are having, and the elderly and everybody else.
What? How positive are you that there's going to be a vaccine by the end of 2020? Do you think we can meet up with that?
You work in the health field, in research. You know how long it takes to do a vaccine, right? How many trials we need. It's so you need to test patients. You need to test. You need to do you know these tests with a good number of people, and it usually takes time. I don't think we will have a vaccine by the end of 2020. I'll be surprised if we do. I hope we have some sort of treatment, but we'll get immune to this by contaminating each other, or uh, I think that's probably what is going to prevail.
That is going to lead me to my next question. My next question is on the fact that if somebody tested positive and they get treated for whatever reason, the immune system becomes functional, they now become negative. Can they get reinfection the second time based on being
Right.
exposed to
I
another person?
haven't heard of someone that was positive and they became negative. I heard of someone that was tested negative quite a few times and then test positive. So it depends. If you do the positive by the swab, right, you have the virus, then we do the serology to make sure that you have the antibody, that you are immune to this. And that's usually what happens. I usually, we know by the flu that virus, they produce strains with time. But I'm not aware if we had cases where we know of strains of this virus yet.
Wow. The next question is this. So in replacement for vaccines, because we don't have vaccines, there have been some publications out there that some drugs can be effective to treat COVID-19. What are your thoughts on that, and the fact that the president used hydrochloroquine
Yeah,
as a treatment?
I think it's very risky, very risky. We have, hydrochloroquine is prescribed for malaria, to treat malaria and to prevent rheumatoid arthritis. So it's a potent medication, right? Why would you use something without a scientific basis that it works, and something that probably can harm you, instead of being cautious and use the safe measures?
Hmm. So you
So
wouldn't use that?
I wouldn't use that at all. I would use what the safest recommendations are, right?
Mhm.
So it's not proven and it can harm me. Why would I use that?
All right. Thank you. Next question is this: based on all this that is going on, you mentioned telehealth, right? You're using telehealth currently. What are
Right.
the other ways that you think this COVID-19 will probably change the
Change.
healthcare system based on the new discovery of maybe hygiene and things like that? What are the changes that you're
That's a
thinking?
very good question. That's a
Right.
very good question. I think we have to be very careful the way we are treating animals, nature in general, the way we are killing animals, right? Sometimes you see so much cruelty out there, and I think that needs to be taken care of. I think that needs to be taken, very, very looked at. Um, um, and this is some practice that are becoming very common all over the world. And so we have to look into that and learn something and probably change the way we are doing things with animals. Um, so that's something that I would probably think of changing this in order to avoid that this comes back. They are talking about a new wave, in the falls. So and I don't think we have a good grasp of how this virus behaves, right? We don't have treatment for this yet. We are trying to control with safety measures. We are trying to control by treating the symptoms in the hospital, but the way this is contagious is pretty fast. It's pretty um um is scary, in a way.
The next thing is this: do you think, just like cancer, right? Some people have cancer and they live 10 years, 20 years, 30 years, 50 years. Some
Mhm.
people live 60 years and things like that. Do you think that can be the situation in this case, whereby although people have COVID-19, but they just can go through whatever treatment they have and they can still live life almost normally? Do you think so?
Well, we have cases in the hospital where patients were in the ventilator, right? They were treated and they came out of that.
Okay.
And hopefully they will. We don't know how these patients are doing after they're discharged from the hospital. Um, I don't know. I haven't heard from that if they are going back or if they are having, further health problems. But uh, it's like any other pandemic. You go through it and you learn from it, you get the immunity, and hopefully that's what is going to happen with this one.
How about body fluids? The body fluids, right?
Right.
Is it very easy to spread between one person and another person through body fluids? You,
Right. So the saliva or these particles is body fluid, right?
yeah,
You
how
is
about
this.
semen? Semen, for example. The semen
Right.
from,
I haven't heard from that, Tolu. So I don't know if intercourse can transmit from one person that is has the COVID to someone who does. I really don't know about that. But if you are in such a close contact with someone and you have the virus, that's you need to be careful. You need, until it's proven that you no longer have the symptoms, and you that's the natural immunity. So if you have it, you are protected. But how somebody else will be protected, it's hard. You're not going to transmit that anymore if you got your immunity. But you know will the other person, um yeah, I'm not sure if that will be some sort of you know passing the virus.
all right. The next question is on the mental
Right.
health of people, based on the impact is this going to mean that there's going to be more psychological things to deal with in case of people actually depression and kind of thing? Is it?
Yeah, I think so. I think so because this is something completely unprecedented, something new that we don't know too much about. And in situations like this cause a lot of anxiety, a lot of we are social beings. We want to be with each other. We want to go out. We want to be out there enjoying places and people. So being locked down, I'm sure this is affecting people then more than we think it is. Um, in my patients, it's causing a lot of stress where they are extremely afraid of going out, of going places because of getting this virus. So it's bringing a lot of anxiety, a lot of depression. And I'm sure after this is passed, we'll have more report of more depression, anxiety during this COVID era.
My next question is this: my sister-in-law went out a couple of days, and she said there was already long lines outside already. So many people going out, they're excited to go to the beach and just enjoy themselves. That leads us to open up the country. What are your thoughts on opening up the country? Is it right to do so, and what is the methodology for doing so that you can recommend?
Right. Well, we have to follow the CDC guidelines, the guidelines out there, right? So they want to restart things, let's say, slowly, with 50% or 25% reintroduction of normalcy. So the same thing with going to the beach, going to restaurants, going to public places. I don't think where you see conglomerate of people where you cannot keep the social distancing, these places should be carefully thought if they should open or not, because it's just people will get, most likely will get more sick. So we have to be very careful. We are talking about reintroducing, face-to-face patients slowly, as well, because when you talk about normalcy, you're talking about normalcy in the whole society, but being cautious, being safe, mindful that you need to follow the guidelines. You need to understand that this is serious, and this you need to protect yourself and you need to protect others.
Thank you. The next question is the lessons from COVID-19. What are the new things that we can learn from this situation going forward? Do you know of anything that is gonna, what is the
Yeah.
takeaway? The takeaway information based on all
Right.
the cases, the new policies and things like that.
Right. So pandemias, they can happen at any time, right?
Mhm.
We always talk about that, and we never thought about eh, this happening so soon and so fast, and it happened. So I think we have to be mindful of safety in general, with food, the way we live life, the way we treat nature, the way we treat each other, with the way we take care of our bodies, right? People who are healthier, who has less disease, who has less health problems, psychologically, physiologically, they tend to be healthier in general. So we need to take care of ourselves. So you can only take care of somebody else or something else if you understand that you do need to take care of yourself. So if this is another pandemic, it can repeat, it can come back in different ways, but we need to understand that we need to take those things serious, because we have a planet that is overpopulated, right? We kill animals, we are damaging nature, we have pollution. So, and with all these things that are negative and can bring consequences, we have to be mindful that the consequences sometimes can be out of our control. And this is something that happened that was out of our control. And we are trying to control it by trying to understand it. So I think people are doing the best they can. I think we are understanding it, but we still need to be very careful.
Thank you. My next question is on funding for research. Many people think that a couple of people brought the idea that there might be COVID-19 coming up in the past, that there was no funding to do research. If there was a possibility that if we had prepared more, there's going to be vaccine by now already. What advice do you have in terms of funding for research and things like that?
No, I think we do need research. We do need funding. That's the only way we can treat diseases, we can understand diseases, and we can have more vaccines through research. We need more trials. So we need incentive, not from the government, but from the private institutions as well. So research is the way to go. We need to understand science, and only understand science through research we can understand how these pandemics or disease in general happens, so we can control it.
Okay, thank you. My last question, because I know it's almost 7 o'clock. Based on the fact that there's so many situations in terms of wearing masks and 6 feet apart and physically distancing ourselves and things like that, people tend to be a little bit rude and not really friendly anymore. Based on that, how can that be managed in the sense that though we're trying to prevent ourselves from getting the disease, but we're still dealing with humans? So how do we manage that kind of situation whereby there's a balance between keeping yourself safe and also being polite to another person that is
right.
very close?
So I always think this way, does that person is not using mask because they don't have access to mask? Does this person is not doing the social distance because they don't have a good understanding of what is going on and believe in science, because on the other side there is a lot of confusion from the message that's being provided, right? And I think when we hear all this message, which is confusing, it's not straightforward, double messaging, so they can pretty much say, such and such is not doing it, is not recommending, why do I have to follow this, right? So I think we have to, that's why it's so important to read, to follow consistent guidelines in places like the CDC, the Center of Disease Control, the places where academias, places where the research is done, so you can inform. And you can inform, you be informed, you use what needs to be used. And of course, we have to understand that not everybody may not have access to that, and we may need to understand that. So with that in mind, that probably give us some food to be, not to be jump into conclusions, right? And be more polite and understanding and good to each other.
Thank you so much, Ana Paula Harwood. Thank you for your time. I hope everybody enjoyed the session, and I will see you again. Thank you so much.
All right. Thanks, Polu. Good to see you.
Yeah, good to see you too. Bye.
Bye.